From the Fox 26 studios, this is Houston's Morning Show.
There are a lot of things to consider before reopening. We, of course, have our health and well-being. We have a lot of financial considerations, too, with now 22 million people filing for unemployment in just the last month. More people than ever out of work. And it's no denying that politics do play a part in this decision. So we've assembled a panel for you this morning to give you a variety of opinions. Let's bring them in. We have our political strategists, Dallas Jones and Jacquie Baly. We also have Dr. Layla Watt-Colburn, an infectious disease specialist at Baylor St. Luke's Medical Center, and business owner Michael Crawford, owner of Paper Street CrossFit. Good morning to you all. Well, Jacquie, let's go ahead and start with you. The president is leaving the decision on how and when to reopen up to the states after initially saying that he has absolute authority. What do you make of the reversal?
Another repeat of a chance for tornadoes and damaging winds. Same thing that happened last weekend. So look for a 60% rain chance here Saturday and Sunday. Some showers late today as well. And then a sneak peek ahead at next week. Look for high temperatures to rise back into the middle and upper 80s with some steamy air returning to our forecast.
Okay, Mike, thank you. I understand our panel is able to hear me now, so let's bring them back in to talk about this slow reopening of the country with guidelines that were laid out by President Trump yesterday and that we're expected to hear from Governor Abbott today about how Texas will reopen. So we have our political analysts that we're going to start with here, Jacquie Baly and Dallas Jones. And Jacquie, let's start with you. The president says he is leaving the decision on how and when to reopen up to the states after initially saying that he has absolute authority to decide this. What do you make about the changes over the past few days from the president?
We couldn't hear you.
Jacquie, are you there? Do you hear me?
I'm here. What was the question? We can't hear you. We're having a little bit of difficulty.
Okay, but you can't hear me. Okay, so do we want to take a break or do we want to come back to our panel?
We can hear you now.
Oh, you can hear us now. Okay, very good.
Yes.
So, Jacquie, let's start with you.
Okay.
The president is leaving it up to the states to decide when and how to reopen, but he initially said he has absolute authority. So what do you make of that change over the past few days?
Sure. The president has said that each governor will be able to approach their state individually. He wants a three-pronged approach into reopening our economy. Our Governor Abbott, has been working very closely with the administration, and we know that Governor Abbott will be making an announcement later on this afternoon. Many of us anticipate that he will announce slowly, but surely, we will start reopening our Texas economy, making sure, of course, first and foremost, that we do it in a very safe manner, but to make sure that we're thriving once again. The fact that the president has said that each governor has the authority to do so is because you have states like ours where we have less than 300 people who have died from this pandemic. And then you have other states that are really, really fighting with their numbers. So each one has to individually make a decision as to the path moving forward.
Mm-hmm. And Dallas, the governor is telling, the president is telling governors, you call your own shots. The guidelines here that I'm giving you are data driven. But a lot of these governors are saying we need more testing and we're not going to make decisions on reopening until we see how widespread the virus is, right?
Well, it's called the Constitution. And I think that's why you saw the president roll back this I am the ultimate authority type of language that he was using. The U.S. Constitution and the idea of states' rights allows the governors to make what decisions they need to make that are in the best interest of the people that live in that state. It's fine for the federal government to put out these recommendations, these guidelines, but be very clear. These are not mandates that are required in order for states to reopen. I think we have to look look at it state by state. I think we have to put public health ahead of all of this. We are in the midst of something unprecedented. And I think at the end of the day, all of us are eager to get back to work. I know I am. I'm eager to get out of my home. I'm eager to get my office back open and running. But at the end of the day, public health has to be what's important. And I expect the president and governors around the country to really prioritize that over economics.
And Michael, let's bring you in. You're the owner of Paper Street CrossFit. Gyms would be one of the first businesses allowed back open under phase one. How has the shutdown impacted you?
Well, it's impacted a lot of us, obviously, from not having to have any type of income, not just as a business, but the employees that we employ. And a lot of these, especially smaller gyms, smaller businesses in general, usually run month to month or maybe a few months out budget-wise. And of course, a lot of our employees live week to week or a very short period of time. So the biggest confusion or the biggest problem that we've had is being unclear on the expectations of what's coming forward. You know, when this all started, it was just April, end of April, couple weeks, make through a couple weeks, and now end of May, maybe even June. It just keeps drawing on and on and on. And we get different stories, obviously, from different levels of government, from all the way from the top to local. And for us, it's just, we would like a clear, definitive answer of what's happening next, what's a true plan. And I know it changes, I know it's new for us all, but it's just, it seems to change day to day. And for a small business that runs on a very small margin of error, that's very difficult for a lot of us and ultimately can be a demise for a lot of small businesses and even mediocre businesses as well.
Yeah, and surely hope that you'll get some answers today from the governor when he speaks at noon. We're going to take a short 60-second break. And Doctor, we're going to start with you on the other side of the break. We'll meet you right back here. Well, let's continue the conversation now on reopening the country in the middle of this COVID-19 crisis. We bring back our panel, and we want to start with Dr. Layla Watt-Colburn with Baylor St. Luke's Medical Center. Doctor, one of the things that has to happen, the president said, is we have to see a 14-day straight period of no increase in cases before we can begin phase one. Just from your standpoint, how are we doing as far as the caseload goes, hospital bed, ICU capacity?
So right now we're doing okay in the Texas Medical Center. All the efforts by the community and that everyone has done has actually flattened a lot the curve, and so we haven't had a big surge. The Texas Medical Center has a website where you can see how many beds we have, ventilators, and personnel, including our personal protective equipment. And as this reopens, we want to minimize the surges because then we can actually take care of this. Just like they mentioned before, one of the key points is going to be testing. In order to have this 14-day free, you actually need tests. I mean, there's no other way that we can say that. The new normal, or whatever the normal-ish is going to be, is going to last until we have a vaccine that can help us, give us immunity, or proven effective in a clinical trial therapeutic that we can use. If not, we're going to continue having these breaks, and then our health system can cave.
So the new normal, not going to be normal perhaps for a while. What would you say to people when these restrictions do start to be somewhat relaxed? What's your advice to people as they try to eventually go about their normal routine again?
So what's going to happen is what we're living right now. I mean, we're going to have a little bit of the social distancing, continue the actively hand washing, and then there's the plus minus if you're going to wear a mask or not. But if we don't have good testing, wearing a mask or a bandana, just covering your mouth so you don't cough and spread the virus to someone else is going to be something that not required, but at least people will look at you. If you cough, everybody's going to turn around and kind of stare at you. And likely, it's large gatherings. I mean, that's where it's easily spread, and that is going to be very difficult for us who are sports fans and like to go to concerts.
And Michael, let me go back to you. If you can reopen next month, what does your new normal look like? And are you worried that people may not come back to your CrossFit gym?
Yes, I mean, I think the people that have been refraining from even being active or being social are kind of going to continue that. I think the hysteria, regardless of what government like mandates, is going to kind of continue on into people's day-to-day habits. But there are people eager to get out and get moving again, of course. Me as a gym owner, not only the fitness but the health of my clients and my employees is very important to me. So I will and continue to go by the strict guidelines of CDC, social distancing, cleaning, and stuff like that. But just to keep moving and moving forward. But still, obviously, this is going to affect us business-wise, like all businesses for a very long time. But at this point, we're willing to do whatever it takes just to kind of start the ball rolling, even if that's at a very slow pace. And of course, leave it up to the experts to tell us what to do, as long as they're clear and they all kind of speak the same language.
Sure. Well, I wish we had more time with all of you. But again, just a reminder that there's no timeline for the guidelines that the president rolled out, and we are expected to hear from the governor about our state today at noon. Thank you all so much for taking some time out of your day to join us. We appreciate it. Have a great weekend.
Thank you.